Welcome, everyone, to the Wellness and Prevention Finalist Spotlight session of the 7th Annual Digital Health Awards. I'm thrilled to be joined by Dr. Stephen Klasko, our executive producer and former CEO at Jefferson Health, and Unity Stokes, president of Startup Health. Today, you'll hear directly from the standout finalists in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Boschert, the show director of the Digital Health Awards. I'm excited to welcome you. This is my 4th year with Digital Health Hub, and it's been amazing to watch how quickly the digital health space continues to evolve. At the Digital Health Hub, we're here to celebrate the innovators shaping the future of healthcare, like you. So thank you for joining us. I just want to take a quick moment to introduce the Digital Health Hub Foundation, the 501c3 nonprofit behind today's session and the annual Digital Health Awards. We were founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed, ultimately improving care delivery, access, and outcomes for all. Today, our community includes over 30,000 innovators, from early stage founders to industry leaders, investors, payers, and providers. Throughout the year, we run educational programming, networking events, and thought leadership series, all leading to our biggest moment, the Digital Health Awards at Health in Las Vegas, where we celebrate the companies truly transforming healthcare. We're proud to shine a light on this ecosystem and grateful to all of you for being a part of it. Congratulations to our 2025 finalists. Bless you. Your innovation, passion, and impact are helping to shape the future of digital health. We're proud to recognize your work on this global stage. And now I will introduce Jason Saltzman, Head of Insights at CB Insights.
Nice to
Sure.
meet you all. I'm Jason. I'm the head of insights at CB Insights. We're partnering with the Digital Health Foundation and the Health Conference as the predictive intelligence partner, hoping to provide sort of more information, more data, and more insights on the companies building the future, or companies and technologies building the future of healthcare. And today, hopefully, going to share at least a little bit of the context and framework for what's going on in the wellness and prevention market, and tee up all of your awesome presentations. So with that, we again, I say this every time. Please ignore 2021. No one knows what actually happened at the end of at the end of the ZERP era, with how crazy funding was. What we're looking at is, still sustained levels of high funding to the wellness and prevention markets, right? What I guess some would dub the longevity market. Thinking about, sort of what's going on and where that funding is flowing. We've seen, sort of market size is anticipated to grow at sort of over 20% compounded annual growth rate for the next decade. So, ton of space, ton of, even if you go on LinkedIn or your favorite media outlet, everyone seems to like to talk about longevity, wellness, and prevention. Right, we've seen a lot of funding go to some hot segments recently, including those with some incumbent offerings, virtual male hormone care, right? You think about Hims, you think about Roe, and a ton of the providers that have sort of seen their rapid growth over the last era wave, right? We're seeing a lot of money being poured into virtual pediatric care. And then oncology prevention emerges as sort of the hot area, largely driven by a lot of the sort of AI for cancer startups and AI for cancer platforms. Thinking about looking at where we've now exceeded in 2025 alone the annual funding, or sorry, in 2025 we've already exceeded the annual funding for 2023 and 2024 combined across several different outlets, including liquid biopsy, AI for cancer, and digital pathologies. And we see a few other emerging spaces in brain-computer interfaces and some of the wellness and prevention applications there. And then midlife women's health, with Meaty raising already this month, raising a nice Series C. As we look at the technologies driving a lot of the innovation here, obviously everyone gets to wave their hands and say it's AI that will define the next wave of innovation. But we're also seeing a lot of sort of continued push around wearables. When you look at new products from the likes of Whoop or Aura, and some of their competitors, the purchase by Amazon of the company whose name I'm forgetting, that sounds like a B, uh, a month or so ago, right? There's a lot happening in the wearables and sensors space. And we see this with a lot of the increases in revenue from a lot of the incumbents as well that are disclosing public values. When we start to look at where we see things going next, we're seeing a lot in sort of the blend between consumer wellness and clinical prevention, and the sort of platform plays that integrate both the digital experience, the wearables, AI, telehealth, and we're seeing that in sort of mobile subscriber growth rates across all of the platforms that play in the space. With that, I will hand it back to Bethany, and hopefully that gave a little bit of a intro on what's happening in the space.
Yeah, thanks, Jason. Thank you, thank you. Okay, now it's my pleasure to introduce someone who brings a unique lens to this conversation, combining deep healthcare expertise with a sharp eye for transformative innovation. Unity Stokes is the president of Startup Health, and we are truly honored to have him with us today. Welcome, Unity.
Thank you, Bethany. It is an honor to be here and so proud and honored to be the category champion for this category. I think the wellness and prevention category is a really fundamental one in that it's really an umbrella category to all of health and healthcare today. I think that chart in one sense is a little misleading because what we're starting to see is how health and wellness and prevention is being integrated into all aspects of the industry today. So I hope we dig into that with the amazing best-in-class winners and rising star winners today. It's my great honor to also be here with Dr. Stephen Klasko, who's the executive producer of the Health Hub Awards. And one just quick note before we get going here. Startup Health is really excited because we're going to be doing a joint pavilion this year for the first time with the Digital Health Hub Foundation at HLTH. So we've got about 100 health transformers and startups that are all going to be in the same pavilion. So we hope that you all come visit us, check out these extraordinary founders and teams that are really building the future of health. But we want to spend most of the time here, the next 50 minutes or so, with 10 extraordinary companies, hearing very, very briefly what they're up to. And I'll start with a quick question, and then Dr. Klasko will ask maybe a meatier follow-up question. Dr. Klasko, do you want to say any words before we get going?
No, just like a lot of you, I started out doing something and went full circle. I started my career as a DJ. And after delivering about 1,500 babies, being the dean of two medical schools and the CEO of two academic medical centers, University of South Florida, which if you want to know everything about the logic of Florida, the University of South Florida is in Northwest Florida, enough said. And Thomas Jefferson University and Jefferson Health, where I was the first joint president and CEO. Wrote a book with Hemant Taneja called On Healthcare, a Manifesto for Health Assurance, which has now become General Catalyst's platform. I now work for General Catalyst and I'm board chair of .go. But again, going back to your roots, I will be DJing the Digital Health Hub Awards after party that you're all invited to, and hopefully we'll have some award winners on this Hollywood Squares at the Chica Lounge as Stevie K, the DJ. So a full
I'm
circle
so
after
so
40
excited
years.
about this. Amazing, and I want to hear more about that book later too. Um, so excited you'll be DJing, but why don't we kick it off? The first amazing company we're going to hear from is Vori Health. Ryan Grant, if you're there. What I'd like you to do is tell us why you're awesome in 60 seconds or less, so we all have a sense of what you're building, and then Dr. Klasko will ask a follow-up question.
Perfect. Thanks for having me. We're a 50-state medical practice focused on musculoskeletal and orthopedic care. So we employ physicians around the country, physical therapists, and care teams to take care of back, neck, hip, knee, hand, foot, shoulder pain. I'm a spine surgeon by background. I practiced at Yale University and Geisinger, and I'll be the first to admit that we did a lot of inappropriate surgery at the academic centers. And so I actually shut my practice down to tackle this industry. Why are we awesome? About 40% of our patients have failed other offerings, including brand name health systems, and we'll get the people, those patients better by practicing differently, organizing differently, combining both wellness, telehealth, AI, all those trends that you talked about to really put a personalized care team and plan right around the individual. And excited to be here.
All right. Stephen, you want to ask the first question?
Yeah, I just where do you so I look at everything from 10 years from now. My new book is I'm the Chief Digital Health Officer for President Taylor Swift. The Swifties have become a political party, and our healthcare motto is make it tailored and make it swift, neither of which is true in 2025. So if your company is successful, what changes for healthcare? How is it more tailored and swift in prevention? And how are you making sure you're not just making the wealthy healthier?
That's a great question. Would love to see more people copy us. We like to be provocative in nature. I'll be the first to talk about not really sure orthopedics is the right specialty to take care of orthopedics. I think the country has lost track that orthopedics is short for orthopedic surgery. I'll be the first to admit, as a spine surgeon, I have no training in non-operative conservative care, but was always asked to triage all those patients. And so would love for people to take a step back and are we doing the right care for people with the right team? Are we not just digitizing the broken in-person care system? Would love to see people stop talking about digital versus virtual versus in-person. It's just care. Nobody talks about virtual banking or in-person banking or hybrid banking. It's just banking. Nobody talks about virtual shopping or in-person shopping. It's just shopping. And like you see in the other verticals, people are really down to personalization, whether it's on Spotify, shopping. Amazon's very good at picking things up that you might want to buy. So is Netflix. And we'd love to see healthcare really put the patient at the center. We talk about it a lot, but we tend to have the health system, health plan, and providers at the center versus the individual end user. So 10 years from now, care is care, doesn't matter the modality, and Taylor Swift's at the center of all of it.
Shake it off.
And maybe we'll hear a Taylor Swift song or two on the DJ card there.
For sure.
All right. Well, thank you very much, Ryan. I'm going to keep this moving. Healthy Minds Innovations, Ivan Hernandez.
Hey everyone.
So
So
to kick things off, same question, your 60-second elevator pitch. Give us a sense of what you're building and why it's innovative.
I'll start with a question to a question. Hopefully that's not annoying. But what if I told you that well-being is a skill that can be learned? Our company, Healthy Minds Innovations, is a global nonprofit. We take real, rigorous science and sometimes archive science and we take it out of the lab, off the shelf, and translate it into practical tools, tools that have been proven to give people and communities in over 140 countries governance over their ability to respond to challenges. And so we really take this science and help people really apply it. And the reason we're here in this category is because we like to say it's also for preventive measures to equip them to face life's challenges. And so we say rigorous science, as in validated well-being science that's been formally published by leading researchers across specialties from some of the world's top research institutions, including our sister organization, the Center for Healthy Minds at the University of Wisconsin-Madison. But one of the best examples that I can give you of what makes this unique is the Healthy Minds Program app. It's free. It's received acclaims from New York Times, Vogue, Sports Illustrated, Business Insider, and it's been the primary vessel which has helped us scale some of the scientific framework that we've realized have helped people learn the skills for well-being. And we found 18% reduction in anxiety in some studies, 24% reduction in depression, 28% reduction in stress, and at least 70% of the participants experienced decreased distress. So in addition to general population, we've also studied impact in high need-based sectors like teachers, caregivers, emergency responders, et cetera, and workplace. So today I'm excited to share a little bit more and how we're scaling those original studies with all these different groups into just to help people learn the skills for well-being.
Okay, we're going to cut you there. Dr. Klasko, first question. Are you there? Dr. Klasko.
He looks frozen.
Okay. So tell us exactly the business model around what you're doing and how you plan to scale.
Yeah, so I'll sort of spare this group all the health stats because we know communities everywhere need preventive and empowering resources. So our strategy is actually mission based. That's why we're happy to be here with the Hub, foundation to foundation-ish, or nonprofit to nonprofit, and we're highly focused on reaching people and communities where they are, as in like, literally at home, school, workplace, at play, but also where they are in their well-being on whatever spectrum, whatever state they feel they're in, and ASAP because it's needed now everywhere. So today we develop and distribute a host of well-being products for individuals, D2C, exploring micro supports, a lot of AI, of course, resources for educators from teachers to school districts and college and university. So that's D2C and B2B and B2B to B, B2B to C. And then through deeply strategic partnerships with different organizations across healthcare and tech, we integrate science, almost like consultants, like science consultants, into the workplace to really impact how the infrastructure works, how products are developed, and how customers are serviced.
All
And so
right. Thank you very much. Appreciate that. And very quickly, where do people go to learn more about Healthy Minds?
hminnovations.org.
All right. Thank you. Next up, Personal Remedies. Maury Bahar, how are you? Nice to see you. You there?
Yes, I am. Hi, Unity. How are you? Hello, everyone.
I'm great. So to kick things off, you get the same thing. Elevator pitch, 60 seconds or less.
So here's what we do. We have solved two problems that have never been solved before. One is to provide dietary guidance for multiple chronic conditions and their comorbidities, including medications that somebody's taking, which is really the only way you can offer or claim that you provide personalized dietary guidance. Because to do so, you got to take into account all of an individual's health-related topics. The second problem we have solved that has never been solved before is offering dietary guidance at individual food item level. We don't just say eat more vegetables. Let's say you pick 5 conditions randomly. Our nutrition robot can tell you which specific vegetable choices are helpful and which are harmful for that unique combination of health topics. So that is really what makes us great. The fact that we have solved 2 problems that have never been addressed before, and our solution is fully automated.
And walk us into the future. What's the impact you've made, 3 to 5 years from now with Personal Remedies?
Our data basically can be used through our award-winning API and a variety of health tech companies, a variety of clinics can use our data in order to formulate meal plans, dietary guidance to individual patients who suffer from one or several chronic illnesses. Therefore, we can help people to actually solve and address their health issues through dietary choices, through lifestyle choices, through alternative therapies and herbal supplements and the like, as opposed to the conventional approach of taking drugs for the rest of their lives.
Okay, and where do people get access to Personal Remedies? And are you going to be at HLTH again this year?
I'm looking forward to do that. I like to do that, but we'll come back to that later, if you like. Our API is available to the public through our website. We also have a collection of 24 mobile apps. Each of them is focused on one specific chronic illness, and users can select from a list of 300 other conditions as secondary condition. But through our API, You can select any combination of unlimited number of health topics, and for that combination, our API can respond to various queries such as, what are the best nuts and seeds for me? What are the worst nuts and seeds for me? What are the best vegetable choices for me? And so on.
All right. Well, thank you, Maury. As we can already see, there's such a diverse range of solutions here in this category. We've got doctorpreneurs, we've got a nonprofit, we've got this AI platform. Thank you so much, Maury, and look forward to seeing you very soon.
My
Next
pleasure.
up, we have Victor Penev from Edamom. Edamom, are you there? Victor, are you
Yeah,
there?
I'm here.
All
Absolutely.
right. So I've had the pleasure of also hearing your pitch over the years. What is the pitch today? Bring us to where we are. And in 60 seconds or less, want to hear how you're changing the world, Victor.
Oh, we're definitely changing the world. So we started Edelman with one kind of vision and mission that everybody should have a personal nutritionist and make the best food choices. We truly believe that people can live up to 120 without chronic conditions and mental illness, and that healthcare shouldn't be. There should be only acute care and health prevention. And we believe that food is an instrumental part of that. So what we have been building is essentially the data layer to help everybody make the right food choice. We probably build the largest database of food and nutrition out there in the world. And what has been our dream, that personal nutrition is for everyone, was kind of a 50-year vision. Now AI makes it possible. So we're super excited about building with AI personal virtue nutritionists, and that's how we're changing the world. And just why we awesome, despite all the data and every success we've done. I think one of the things that the way we measure ourselves is how many people we reach with our data. And because we have deals with companies like Microsoft and Amazon and Food Network, we reach well over 1 billion people with our data, and that's kind of the metric that excites us. At one point, we want to reach 10 billion, and that's probably just because the population is going to peak at 10 billion.
Thank you, Victor. I see Dr. Klesko, you're back. Questions from you for Victor Penev and Edamom.
Yeah, so I guess one of the questions I'd ask is there's been a huge gap in trust among people as it relates to those of us who are in the healthcare business. We used to be among the top. We're now slightly above Congress. And there's a lot of reasons for that. But when it comes to people my age, I'm 71, but I think as people talk about prevention, wellness, longevity, and health span, how are you going to engender trust in what you're doing, in the technology you're using, and what you're proposing to folks?
Yeah, I would answer the question indifferently. Because we are a business-to-business company, we actually don't interface with consumers. Our clients do. So, fortunately or unfortunately, that is a problem for them. Now, what we do with our clients and give them the confidence to engender trust is that we have probably the most accurate data out there, which has been verified in many different ways. And that's what sets us apart from using a large language model and so on and so forth. But ultimately, it's companies like Noom or Virta Health or MyFitnessPal or Amazon that are using our data, and they have to build that trust. So I know it's not a direct answer to your question,
Well,
but
yeah, but let me follow up on that, because I think that
sure.
a lot of the trust differential literally comes to when we were working with data companies, and we're saying, hey, you can sign up for this. The patients would go, well, how do I trust that company? How do I know my data is going to be secure? How do I know they're not going to sell it to somebody? So, if I was still the CEO of Jefferson, I was worried about that. And, even though you're selling it to me, I want to be able to answer that person. So tell me a little bit about how you would approach that with the health system.
Yeah. Again, it's not a direct answer because one of the reasons we build a company the way we build it, we don't touch personal data. So we don't deal with any personal information. We only deal with food data, and that data we can guarantee its accuracy. But things like security and confidentiality and all that stuff is not something that we are solving. Now, that's not to say that's not a super important question. It is not something that we would want to be doing going forward. We were always focused just on food data and making sure that we provide the best food data in the world without touching any personal data.
Thank you,
Thanks.
Victor. Definitely an important topic here is just trust, verifying data and trust in general. I think this will be a recurring theme. Next up, we have Well4 Health. Anne Marie, are you there?
Yes, sir, I
All right.
am.
How
I
are
am
you?
thrilled and honored to be here. Thank you. I
Tell
appreciate
us
the
about what you're
opportunity.
doing. What's your elevator pitch? Why are you awesome in this category?
All right. Well, with Well4 Health, we are on a mission to break the intergenerational cycle of diet-related diseases among underserved multi-ethnic populations. For us, we have special focus on Black and Brown communities around the world. Well4 Health is a culturally fluent AI food as medicine platform, and we bridge the gap between lifestyle change and clinical outcomes. We combine flavorful, salt-free cooking education, personalized nutrition guidance, portioning tools and best practices, remote patient monitoring, as well as behavior coaching and ongoing support to deliver sticky, sustainable health outcomes. We are just about to scale into the post GLP-1 nutrition continuum to provide long-term care to patients in need after those weight loss medicines. We are currently in our 4th clinical trial funded by the American Diabetes Association and in partnership with Eastern Virginia Medical School. We are positioned to impact preventable emergency room utilization in the long term, but in the short term, we are really just focused on leading indicators around changing the nutrition habits and lifestyle changes within multi-ethnic families.
Thank you so much. Stephen Classico, you wanna start?
Yeah, so what I love is that you're obviously taking care of everybody, and back to my previous question, not just making the wealthy healthier. How are you handling some of the cultural differences in communication and and how people accept what you're talking about?
We have learned over the years, and by over the years, I mean over 10 years, we have learned that we connect and we build trust and we get permission if we can address favorite heritage foods in a healthier way. So one of the biggest friction points that we have identified is that while the person with the chronic disease might want to change how they eat, if they think they've got to cook 2 meals, or if they think it's going to taste really horrible, or if they think they're going to be left out at Thanksgiving, they fall off very quickly. They churn out in about a month on Noom, let's say. And so we focus very intentionally on heritage foods, like, how do you make sweet potatoes without sugar and marshmallows? Or how do you make collard greens without ham hocks? So we focus a lot on flavor, and their heritage foods. Our AI platform really informs us as to what their favorite foods are or what their favorite ethnic cuisines are. And that's our starting point. So we build trust at that point. We take into account, are they in a food desert? Are they cooking for 1 or 2 or 4 or 10? And so that's really kind of that family focus, kind of really just meeting them where they are in a very literal, hands-on way.
Fantastic. Thank you.
Quick question. Are you covering all of the United States or focusing regionally, or talk a little bit about how people would get access to what you're bringing to market?
Absolutely. Yes, we are able with our platform to focus globally. So the answer to your specific question is we can service all of the states within the US, but we have already verified that there is demand for our approach in Dubai, in Mexico, in South Africa, I'm from the Caribbean, in the Caribbean. So the opportunity is there really for us to take this globally at scale with that approach of like favorite heritage foods as the starting point, and then we get permission to deliver the rest of the programming.
Thank you so much.
Thank you. Thank you both for your questions.
Okay, I've got to find out who's next here. NutriCheck, are you there?
Hello, everyone.
Hi, how you
Hi,
doing,
thank
Stan?
you.
Hi.
Hi, Stephen.
If you could start with the same elevator pitch, tell us what NutriTrek is
Sure.
up to.
Thank you. Thank you, Unity. First, let's say I'm truly honored to be with you and so happy to be with you here tonight. So yeah, NutriCheck, we are solving a big problem on Earth based about food. You know, people care more than ever about their health, but most of us are still flying blind. We eat what we think is good. We track calories, macros, nutrients, but we don't really know what our body needs. Every food contains thousands of molecules that interact with our cells in unique ways, nourishing, activating, or sometimes disrupting our metabolism. And here's the truth: 88% of people already show signs of metabolic dysfunction. Not because they don't care, but because they can't see what's happening inside their own biology. And that's what we are solving with NutriCheck. We make your biology visible and understandable and actionable. With what? A drop of blood is all that it takes to sync food with your biology. Our at-home blood test and AI-powered platform analyze hundreds of biomarkers with wearables and lab data to detect early imbalances. And at the heart of NutriCheck, what makes it really unique, it's our digital metabolic twin, digital biological twin, we could say, which models human physiology to show where risk emerge and how you can actively restore balance. So you can test, retest each quarter with our blood testing at home, and even each month from the comfort of your home to track your progress and see measurable improvements over time. And one thing that is very important for me and we are mission aligned, it's to make it affordable to all the people. So to make longevity, preventive health really at the same price of a Netflix subscription. So to make real preventive health available to everyone. That's our goal.
I love it. I guess the question with food is always, why not just put GLP-1s in the water and leave it at that? Or is that what we're going to get to? Because I mean, how do you get people motivated to do the right thing when potentially Americans especially are much more interested in the easy way out, and if it turns out that you can take a pill, once a day or once a week, how are you going to have the company advance under that model?
Yeah, I think we are seeing like big changes with our how we are interacting with technology based on the GPTs and how we chat. And I think the best way is to adapt to each one's agendas. Life is full of surprises. Like every day you have a new thing coming. Even if you have a meal plan, you can be invited by your friends or whatever to maybe eat something else. So even if you take some medication or whatever, we need to create a platform that can dynamically adapt itself. This is why now we have, like, thanks to technology, I think one thing is AI has broken the glass ceiling that you are talking about. And now we can really adapt to each one based on science and evidence-based, for sure, peer-reviewed. And so that's what I would say. It's thanks to interaction and new ways of consuming that we can deliver personalized meal plans with the metabolic digital twin. That's why we are developing this. And I would say also AI has broken the glass ceiling, but also multi-omics. It's like small molecules. So it's a new world. Now we can even see with a loop all the universes we have in our cells.
Great answer. Okay, thanks.
And how do you imagine integrating, or how do you integrate with other platforms, other tools, other types of data sources I'm even thinking of some of the different types of innovation on this session. How are you already doing that, or how have you thought about doing that?
Again, like it's based on technology. I could speak about MCP, like every technology now could be compatible on every LLM on the system. So we need to think about platforms and how the user can use their own data, their own system, even in other platforms, but using the way of calculating, reading the health biology with the twins. We are entering in a new
Yeah.
world. So I think, yeah, many things are, we need to do many things. So APIs are good in terms of technology, but we are going to enter in a new world. And yeah, I think, yeah, the way of modelization is one of the key, and to adapt to each user, and always to repeat that the datas are for each patient. We are just like helping them to deal better with their health, nothing more.
Thank you. And I want to get, Dr. Klesko, I want to get that GLP water brand. Maybe that's a good domain name we should buy early.
Yeah.
Start buying the water. Okay, next up, Guava Health, Isabel Stewart. Are you there?
Yes, hi.
Hi, how are you? Thanks for being here and congratulations. What's your elevator pitch? Tell us why you're awesome in this category.
Yeah, so Guava is a personal health application and coming at it from a holistic approach. So we provide clarity and insights without overwhelm. If you've ever gone through the healthcare system in the US, you know how siloed and disparate these information systems are. And so at our core, we're solving an information problem. So we're integrated with over 60,000 different healthcare facilities, as well as top medical and fitness devices. Like Omron, Garmin, Withings, Whoop, et cetera. And then we also support for real world data tracking. So you can actually just talk to our Guava assistant, which is a virtual assistant, and say like, today I woke up with a headache, 9 out of 10. I had coffee for breakfast and some yogurt, and my mood is a 5 out of 5. And then over time, the Guava system will start surfacing statistically significant correlations. So you'll actually start understanding what is impacting your health. And health can look different for everyone. So for example, someone may be training for a marathon and someone else may be managing 5 chronic conditions. And so we've really built out this holistic ecosystem to support everyone wherever they are in their healthcare journey.
Thank you. Dr.
So why did you call yourself Guava? I mean, I'm a big fan of Guava, but I didn't necessarily relate it to having all my data in one place.
Yeah, so there were a couple of different names that were being kicked around. Guava is short, easy to remember. It's also neutral or net positive when people think about it, rather than having something that's already associated with the name.
So how, I guess the question would be how quickly can you react? So I have an Oura Ring and 2 Apple Watches, and they compete with each other, and with all of that, I had a Mayo Executive Wellness thing, and I got all the things I should do for the next 15 months because I do run marathons. But as luck would have it, I tore my hamstring tendon. So all the diets and everything that Mayo had told me to do, clearly I couldn't do because I couldn't exercise, et cetera, et cetera. But they had no way of getting that data back to them unless I called them on the phone and said, hey, by the way, everything I said I'd be doing exercise-wise and eating-wise has changed. So how are you going to coordinate with, my Oura Ring, my Apple Watch, my Mayo Executive Wellness folks, et cetera?
Yeah, so there's a couple different ways to answer this. One, from the information and data collation point of view, is through the integration. So we are integrated with Mayo, we're integrated with Aura, we're integrated with Apple. So you'll actually be able to see all of that information alongside of each other within this one app. Past that, when talking about reducing information gaps when talking with providers, there's a few different ways. One, the fact that, we exist in a system where faxes are still like the primary way people are sharing information is insane to me. And so we built out this provider dashboard that allows patients to share their information with their providers And all of the data can, it's a repository, right? And so it can be noisy. And so we built out the provider dashboard to effectively cut the data in a way that allows for the providers to see the relevant information in 30 seconds or less, and then dive into the more relevant things or the richer data set if they have the time and if they're interested in doing that.
Great.
Are you also tying into continuous glucose monitors and other med devices?
Yeah, so we're integrated with Dexcom and Libre both. Those are the two primary ones for CGM. And then you can also see, medications or food that you're eating or activities that you're doing on top of the CGM graph.
Okay, thank you. All right, we got 10 minutes to go, and we're going to move on to the best in class category. And we're going to start with Hello Heart. Bill Otten, are you there?
I am. Thank you, Unity, and nice to meet all of you. And let me say we're also
All
honored.
right, Bill.
Can you hear me?
Tell us what you're up to at Hello Heart.
All right. Well, first, Stephen, I have a name for your GLP water. I just thought you could call it Gulp One. I think that would be a good brand name. Anyway, let me start by just telling you that our mission at Hello Heart is to eliminate avoidable heart attacks and strokes. As many of you may know, cardiovascular disease is the #1 killer of American adults in the U.S. has been for many, many years. And it's not only the #1 killer, and it's the highest cost, usually #1, #3 claim costs due to chronic conditions and hospitalization. But another interesting fact is that there have been many studies that have been done that show that 80% of these events are avoidable. We just have to do a much better job at prevention. So what we're focused on is giving people in tools that they can use in the privacy of their own home to track their blood pressure and their cholesterol and their weight, their activity. We provide risk detection. I'll get back to that in just a second when I tell you why we're awesome. We have an AI-driven coaching mechanism to take in the data and give people personalized coaching. We have medication adherence tools. Most of these blood pressure medications are generic. Some of them cost nothing, but getting people to take their medications on a regular basis is challenging sometimes, and medication only works if people take it. And then we also provide reports so that the patient can have a different conversation with their provider about what's going on with their particular health. So back to the risk detection, we recently had a county executive for one of the large benefits consulting houses speak at a conference last week. And basically he told health plans, employers, public sector entities that because he had the Hello Heart unit, it saved his life. He was having some issues, took his blood pressure. Our monitor told him that he was having a cardiac event. It had a button that said push here to call 911. His wife took him to the hospital. His cardiac surgeon arrived. He had 100% blockage of his coronary artery, so it was a widowmaker. And his cardiologist said he'd only ever seen one person survive that in his entire career. So he credited having the Hello Heart unit to getting him to the care that he needed more quickly. So I think that's what makes us awesome.
Thank
So
you.
as somebody who's had a bypass, I certainly appreciate what you're doing. I guess do you see the product? I mean, because one of the interesting things, about where things have evolved is with lifespan and life longevity and health span is that cardiac disease has largely become treatable, whereas as people get older, cancer will become more of an issue. So do you see this something that everybody should have, or is this something that just people who are very high risk for heart disease?
Well, Steve, I also run marathons, and I was surprised when I hit the exact age when men in America are just diagnosed with hypertension. I was diagnosed with hypertension also. So there's two categories here. We should go after the high risk people because it's the right thing to do. Help not only help them avoid heart attack and stroke, but also a higher quality of life to avoid those events. But then we also have to find the people that are starting to be at risk. It could be pregnant women that have hypertension. It can be, there's a lot of different risk factors for it. And keeping those people from ever getting to stage 2 hypertension is also one of our goals.
Great.
Thank you, Bill. Next up, Included Health, Ami Perek.
Yeah, hi everyone. I'm Amy. Thanks for having
Amy,
us.
sorry for mispronouncing.
Oh, no worries at all. So Included Health, our mission is to raise the standard of healthcare for everyone. So, we're not bold over here. We do that by providing personalized all-in-one healthcare for our members. Our members are nearly 12 million Americans across all 50 states, mostly employed by self-insured employers. So it's the working Americans of America and their families. How we really do that is by providing stuff, whether it's about your mind, body, or wallet in healthcare. So I think, Unity, you opened by saying wellness and prevention is this really umbrella category. Well, that's where we play. We're not trying to solve one part of healthcare. We're trying to make the whole thing easier for you. Make it really simple. You got a bill you don't understand? Come to Included. You want to find a primary care doctor in your neighborhood? Come to Included. You want a virtual behavioral health visit for your teenager? Come to Included. Make it easy, make it trusted, so that everyone can live a healthier life while we navigate this healthcare system we've created in America. I would say the metric we're most proud of, our True North metric, it's at the top of our pillar when we talk, is healthy days. So that's a CDC approved measure. You ask people, hey, in the last 30 days, how many of them have you not been able to live your best life for mental health or physical health reasons? Subtracted by 30, you get a number. When somebody interacts with any of our clinical services, they get back 2 healthy days per month. That's nearly a month per year. That's when people can, our employers hope that maybe they show up to work more productive, and maybe that's what they're doing with that extra time, but maybe they're actually going to their kid's soccer game, or maybe they're helping their older parent out who needs help with something. But that's sort of the True North metric by which we do every single thing at Included.
Thank you, Amy.
Yeah.
So I guess, one of the tough things I think in American healthcare is some problems are pretty intractable. So I love how broad the company is, but if it takes 3 months to find a good behavioral therapist, how do you handle that, right? I mean,
Yeah, we don't let it take 3 months. So, as you probably know, we were formed by the merger of Grand Rounds and Doctor on Demand, and we also purchased a company called Included Health and took that name because we are personalized all-in-one included care. And one of the reasons we did that strategically was because we believe that certain things, primary care and behavioral health being top amongst them, you should not have to wait 3 months to get care. And so we had to be a part of the supply solution, in addition to helping you navigate the network that you happen to have today. And so in our behavioral health practice, you actually get in within 7 days, whether you need psychiatry or you need therapy. And if you really need in-person behavioral health, we will help you get in as fast as you possibly can through concierge referrals. So make that phone call from you, advocate. It's one of the hardest parts of healthcare. And this is where technology can solve a lot of things, but sometimes you also need humans. So we use AI for a lot of things, whether it's member services questions, whether it's our provider match algorithms. But we also know sometimes you just need humans to do the hard work because there is a deep underbelly of healthcare. And so we hire those humans and they do that hard work.
Right.
All right. Humans are still relevant.
Turns out you still need them in American healthcare.
All right. Thank you so much, Amy. Last up, Point Click Care. Hamad Husseini, are you there?
Yes, I am. Thanks for having
All
me.
right. Thanks. Bring us home here. You've got 60 seconds for your pitch and then a follow-up question from Stephen Klasko.
Great. My name's Hamid Husseini. I'm the Chief Medical Officer here at Point Click Care and practicing emergency medicine physician. Point Click Care is the leader in providing electronic health services for post-acute care facilities in the United States, as well as Canada. And we take this with great responsibility. Obviously, having this and being this in this position, we get a lot of data, and part of what we've created over the past year is an opportunity to be able to take this data and provide some wellness component to those residents that we that we are the trusted advisor as the electronic health record provider at these skilled nursing facilities. And so we created a product called the SNF summary. And so as a practicing emergency physician, I'll explain how this works quickly. Patients come to the emergency department for a myriad of reasons. And historically,
this usually is provided with either very little information or a data problem, which is what we call a ream of paper that is sort of dropped in your lap. And so often what happens is these patients are misdispositioned and often readmitted to the hospital. We know that readmissions in this population causes increasing in morbidity and mortality, as well as a cost problem. And so we have a technical solution to that, where when these patients are registered in the emergency department, it queries the electronic health record and creates a standard pushed integrated SNF summary that allows that provider real-time information to create the most appropriate disposition for these patients, and ultimately reducing readmissions, subsequently reducing morbidity, mortality, as well as the cost that this weighs on our system.
And so I want to make sure we have time for one question. Sorry to cut you off. Stephen Klasko, you want to ask the final question here?
Yeah, I mean, you can continue, because I was going to ask you, how do you work out the communication, right? I get discharged from the hospital. I'm in a SNF. Let's say I might need to go back, or you have a question to the doc that admitted me. How does that seamless communication work under your model?
So it's mostly via ADT communication and HL7. So when a patient comes to the hospital, it sort of queries our network through an HL7 interface and messaging, and then it basically integrates into the EHR of choice at the health system, regardless of what they have, a standardized reporting mechanism that just queries that data and creates that report.
Great.
All right. In the interest of ending on time, first, I just want to thank everyone who did an amazing job. I really thought everyone did a great job. And thank you all for the work that you're doing. This is a very meaningful category. The work you're doing is meaningful. And it's very hard. So thank you for that. Bethany, I want to turn it back over to you to round out the show here.
Yeah, and just one last thing. You would ask for a Taylor Swift song. I'm going to go with Everything Has Changed, thanks to these 10 amazing companies. So, thanks.
Be sure to mark your calendars for Monday, October 20th, where we crown our winners live across 4 stages at Health in Las Vegas. So there is an agenda on our website. It's under the Grand Finale Agenda tab. There's an add to calendar for each of the stages, so you can see which one you're on, and you just hit add to calendar, so you'll know where to go. And don't forget to join us afterwards at Chica in the Venetian from 6 to 9 to toast the winners and celebrate the entire digital health community, like finalists like you, and to see Klasko DJ. I'm in it for that mainly. So congrats to all of you, and thank you for being on this session today.
Pitbull is an old ball guy too, and he did pretty well. So
well, now I'm excited for Taylor Swift to be playing at this.
Yeah.
So thank you, everybody.